And also in terms of managing chronic conditions, and I know a lot of you work with people who have chronic conditions such as diabetes or asthma, and it's one thing that they need to manage those, but then to manage their health insurance, it's like it could seem like another big burden for them. But I think if you're able to present the information to them and the importance in ways that make it understandable in little pieces that can make it that they might not feel so overwhelmed if they are by that. The value also of health insurance is for cost savings. Protection from high medical costs that could put a consumer in debt. They can affect their credit or cause bankruptcy, as we all know. Insurance companies negotiate rates with the provider, so you, the consumer, pays a lower rate, which is generally a 40% savings from those that are not insured. And I think a lot of us already know that if you go to a doctor or you get some services either on your own or from your consumers, and you can find out like what they paid versus what would ordinarily be billed, or you can see on the EOB, the explanation of benefits, what the cost was, but what they were billed and what they actually were paid. So again, one of the important things, it might sound a little fluffy, but it's peace of mind, right? Again, just if people are dealing with many things, it's the cross-cultural implications of the healthcare coverage and what is it, why do I need it, and the burdens of if someone's got chronic conditions or something, that it's by explaining it and having information in easy to absorb information, it gives them a little bit less anxiety or stress perhaps. And also protecting their family's health. Again, number one, or the individual's health. And just as a note here, that 62.1% of all bankruptcies have a medical cause. So how does health insurance work? All right. I think, basically, I won't read all these points, but basically I think that big, broad networks have lots of providers, right, that cost more, basically. So one way to control costs is to offer lower premium costs, but then this could mean that there's fewer provider choices and a smaller network because these providers agree to the rates. Does that make sense? Basically, it's if you want to pay more, well, then you have more option. If you can't afford to pay more, you have less option. Again, it's true with health insurance. It's true with many things. And again, this basically talks about that. Health insurance companies contract with certain hospitals, doctors, pharmacies to deliver